Last year, a man in Milton, Massachusetts, about 12 miles from where I'm sitting, pled guilty to injecting clients with unapproved botulinum toxin. So, not real Botox, Photox. Something fake. 10 people got botulism and some were hospitalized. This wasn't a back alley operation. It had a name, it had an Instagram, and it had clients who trusted it. Today, we're going to talk about the uncomfortable truth sitting underneath that story because it's not an isolated incident, unfortunately. It's a symptom of an industry that has grown faster than the rules designed to govern it. And most of the people getting injected right now have no idea how to tell the difference between safe, qualified providers and someone who is genuinely winging it with their face. Welcome back to HonestLee. I'm Dr. Chris Lee, plastic surgeon in Chestnut Hill, right outside of Boston. And this is the show where I give you the honest answer, the one a good friend with my training would give you, not one calibrated for liability or likes. All right, so today is exciting. We have our patient coordinator, Jenna. She is honest to a fault. And the first of most patients here in this whole process. So she's not here as a clinical expert, but she knows what patients are actually thinking, Googling, and worrying about. So welcome, Jenna. We're excited to have you. So let's just start this off by asking you sort of a basic question.
Okay.
What's the one thing patients most consistently get wrong before they even book anywhere to get injectables?
I don't even know where to start. I would say, some people are going to their dentist. Some people are going just to find the cheapest place to go. Honestly, they're just booking ever.
Yeah. And they don't like think about it. They just kind of book. They're not, figuring out what's right or who the right person to go to
No,
is.
not at all.
Got it. And that's the perfect setup for everything I want to talk about today. So let's get into it. The simple question, and one that surprisingly has a complicated answer, is who is allowed to inject Botox today or filler? And really, it depends on the state, and it can vary pretty widely. Now, the one thing that's constant throughout is, if you have an MD and a DO, so if you're a trained doctor in osteopathic or allopathic medicine, you can inject in all 50 states,
Oh, wow.
which honestly, even that is not necessarily
Kind of insane.
like anyone who has an MD, whether they were trained as a pathologist
So
or
I could inject.
yeah,
you're
totally.
saying.
Yeah,
Okay.
absolutely. Yeah.
Okay.
Makes a difference. But yeah, like it's crazy. Anyone, that is the only thing you need to be like, all right, I'm going to inject. Now, obviously people will hopefully get some sort of training, but what that training is, no one really knows.
Yeah.
After DOs and MDs, then you have NPs, who can inject in most states, just depending on the state, and usually under the, auspices of a physician. And same thing with PAs, usually under the guidance of a physician. And then there's nurses. And in many states, nurses can inject, but often require active physician supervision. And the type of supervision can vary kind of greatly. And then finally, there's estheticians and cosmetologists, which should never be injecting. Like if anyone says they're a cosmetologist,
Run.
run for the hills. You might die. So just take that into consideration. So that's the first thing you look for is credentials. Now, when we're talking about credentials, there are a lot of loopholes, as you know. Some states only require a physician to be available. So maybe not on site, maybe not even like in the same
There's no
state.
way that's a thing.
Yeah, it is crazy. And it's like, so all these people do. And I've been approached about this. Like people will call me or text me and just ask if I would be willing to be their supervisor, having never met me. Not once.
That's insane.
It's crazy.
That's insane.
So
And you guys can't go there.
do not do that. Do not do that. It's against medical advice. There you go.
Yeah. Honestly.
Yeah. So you could end up in a practice that is covered by a physician who has never, met you, who just signed off on protocols maybe once, if that. And, they're technically the medical director and they could be the medical director of like 12 different sites.
That's insane.
Yeah. Or more. And I know personally in Massachusetts, people who are medical directors, and this is how they make their money for so many people. And all they do is skim some off the top. And that's how they're happy with that.
That's called a scam.
So, you got to think about that. And there's a name for it. These are called ghost doctors, people who only lend their name and nothing else. They're licensed physicians. They give their DEA or their NPI number to the people who are really running the practice. So generally, hopefully at least nurses, and they're technically giving oversight, but they have zero involvement.
That's got to be like a liability, though.
It absolutely is a liability. And what happens is that those doctors are covering their liability. So their medical malpractice will cover anything that happens. And technically, they should be available. But
holy crap.
Even that
wow.
isn't. Yeah.
Oh my
Yeah.
God.
Yeah. So, and I guarantee, like, people, I'm sure I know some of our patients have ended up in these places. And I definitely know other people, as we already talked about in Milton, end up in even worse. So there's that. And a lot of times these practices or these med spas will make it look more official by having the doctor's name out there.
Oh yeah. I've seen it before.
Yeah.
And I'm like, oh wait, maybe I don't want to get it Botox with you. Like, I'll go there.
Yeah.
Pretty.
Why are we even here?
Why?
And it's possible. And I know this too, that medical provider that's supervising them, they may not even have ever injected someone. Like, I personally know someone who's asked a gastroenterologist who's never injected except maybe in the butthole.
Okay.
Yeah, so there's that. So, I mean, if you want an ass face, but they've never injected in the face. They've never injected filler. They literally are only giving their NPI or their DEA so that someone can then do this on their own.
And it's probably like very generic too. So like, you're
Super
just giving like Botox in the forehead is the same for every single person.
Absolutely. Yeah. And it's unfortunate because, I mean, these nurses, some nurses may be decent injectors, but the reality is something goes wrong.
Right.
That's when it's an issue. So, that brings me to my HonestLee scale for sort of the injector market and the transparency about who's performing your procedures. And I'm going to give it about a 2, maybe 2.5, because the marketing is all confidence. It's this, we're great. Like the med spa might be gorgeous. It's, done to a T, and the credentials are all up on the wall.
The people that they're advertising probably didn't even get Botox with them.
Right. Or they're just getting it for free, and who knows? And they're just taking their chance. But the reality is that it's really a murky chain of delegation, and the patient's usually the last to know.
That's horrible.
Yeah.
This literally makes me want to reach out to every single one of our patients just to like check in. Like,
okay, are we good? We just need to check your face, just so we're all good.
Oh, man.
And
did I go too early?
No, you're fine. And the reality, so I bring this up because, yes, in general, injections are not like the most complicated thing. Right. Obviously, there's finesse, and obviously experience matters, and knowing your anatomy matters. But a lot of people can take a quick course and think that but there's a lot that can go wrong.
It goes muscle, and you're frozen, or
and that's just Botox.
Blind.
Yeah, and that's like the easy stuff. That's blind.
Well, blind, isn't it? If you do like in here,
absolutely.
Nose?
Yeah, absolutely. Yeah. So what Jenna's referring to,
I'm a medical director.
Yes, as you know. So what Jenna's referring to is vascular occlusion. And vascular occlusion happens when you inject in or around a vessel that is supplying either blood supply to skin, could be eyes, could be muscle, could be a lot of different things. So when that happens, that is a medical emergency, and it could lead to blindness. It can lead to skin necrosis or wounds in the face or lip. And that is something that needs to be addressed immediately. This is not a joke. This is emergency. Like, it needs to, and it needs someone who can recognize it immediately and respond. So, these are really important things.
Yeah.
And there's stories of not too long ago, just in 2023, someone on Newbury Street. So this is downtown Boston, where you would just assume that like people would would know their shit. They were injected, had a vascular occlusion, and the provider literally gave them a piece of paper.
Stop.
A piece of ripped up like Post-it. I mean, I know you love your Post-its.
I do.
But gave them a Post-it and send them to the ER with a torn up piece of paper saying what they needed.
That's wild.
Isn't that crazy? And that's not like, that is not a horror story. That is something that actually happened here in Boston.
Holy crap. Wow.
Like, can you imagine?
No, I actually.
The person who's taking care of you sends you to the ED because And the worst part is the ED is not equipped for this, because why would they be?
Right.
There's no reason why an ED would have the correct medication that you need in order to help you through that situation. So
Knowing the anatomy, important.
knowing the anatomy,
Right.
very important. Knowing how to fix problems that can happen, even more important.
Yeah.
So,
Wow.
making sure you have that stuff available is super important. So, because of all this, like where you go and who injects you is more of a medical decision than it's a convenience issue. Now, med spas are very convenient because they're all around the place and all around the sort of metro Boston area. But
Mhm.
you got to remember that it's not just, this isn't like a haircut. This is a little bit more than a haircut.
Right.
Not only are you investing money in it, but it's, there's inherent danger in it. And while these are very safe things when done correctly and under the right supervision, you know, things can go terribly wrong, which no one
Yeah.
wants to be that patient.
No. No, because then you come to us and we correct you, and then you pay more,
Yeah.
double.
And the correction could be surgery, which is,
We don't wanna go there.
we don't want to go
Don't go
there.
there.
It gets ugly. Now, let's talk about how some of these people are getting to the point where they're even injecting. If you take out your phone, take out your phone right now.
Okay.
All right. And just search Botox certification course right here and right here.
I'm gonna voice text that. That was long. Botox certification course.
And then just like how many.
Oh, 8 hours, guys. 8 hours. So come to me.
Yeah.
I'll be certified tomorrow morning. Wow.
8 hours, a 1-day course, a
Insane.
weekend, like fully online. And the end result is they get some sort of certificate they can put up on the wall. And they'll probably say something like board certified in aesthetics or master injector or advanced
Doctor of
aesthetic.
aesthetics.
Exactly. All BS. Like there was no board
Bullshit.
in aesthetics. This just doesn't exist. And there's no like master injector award or anything like that.
So, like, how do patients know? How?
It's a great question. Well, none of these are issued by medical boards, so you can't look up whether or not someone has these certifications. They're issued by private companies running for-profit organizations, pumping providers through as fast as they can to make more money. There's no,
Damn, I'm in the wrong business.
yeah, exactly. It's not, guaranteed by the American Board of Medical Specialties. It's completely made up. And there's no standardized curriculum. There's no independent testing.
That's guys,
And
I hope you're listening closely to this.
and there's no minimum supervised injection time. There's no residency in this, right? So yeah,
Blows my mind.
it's crazy.
Wow.
So you got to be careful with who you pick, and all they really need is to have paid for this course, and the private company that's put it on decides and entitles them this certificate.
This is insane.
Now, that being said, I am not saying that all nurse injectors are bad. There are certainly good ways to train a nurse that make them very adept and very good. Like I know plenty of great nurse injectors.
We have one at our office.
We do.
Chabelli.
And she's fantastic. And she does a great job and she really cares about her patients and she takes her time and she is very thoughtful, but also very safe. And she's always running things by me because she always has access to me. And, she's well supervised and, she knows what she's doing. But that took years to get to there. And
Not 8 hours.
exactly. Now, and when people are taught in that way over time and sort of almost as percent or what's it called? Apprentices, then they build those skills over time. And they also take courses and they continue their training and it's ongoing. And they go to, lectures and then they get their CME and they have continual education to get them to where they are. And they're always getting better. But you want to make sure you're not going to that person that's just done a weekend hotel conference room course and gets a certificate that's printed out.
Right. Okay. So what should we be looking for? Like when we're booked, or what should they look for?
So
How would you tell
it can be difficult. It can be really hard. And mostly you can't really tell.
We're going to solve this right now. Come to Clareo Plastic Surgery.
Like anyone could tell you anything. And social media makes it even harder. It rewards confidence and aesthetics over, substance. And if someone's really good at taking pictures and really good at, lighting and making their before and afters, and they're good at presenting that to you, that can really sway you towards maybe someone or away from someone who might be better trained and isn't playing the Instagram
What
game.
about AI or like people?
AI Absolutely. Or AI and filters, really.
Yeah.
I mean, even without a filter, like putting the right lighting on someone makes a huge difference.
Yeah.
Taking a picture with someone without makeup on versus
Oh,
with
yeah.
makeup on, huge
Right.
difference.
Yeah.
And these are all things that I tell people to look out for when they're looking at social media, even in the office. Like there are times when then Mari, who's our other patient coordinator, will come to me and be like, this looks really great on Instagram. Why don't we do that? And I'm
Right.
like, well, hold on. This is not exactly a real situation. And you have to be careful to look out for those things. And obviously, it takes some training to know when that's a thing, which is unfortunate for everyone out there trying to get these things. But it can be very difficult. And it can be difficult for almost anyone, even someone who's well trained. But to give you context on what good training looks like, you can take, a plastic surgeon. I did med school for 4 years, you know, general surgery for 5 years, followed by 3 more years of plastic surgery. So that's 8 years after med school that I did training, where we're looking at anatomy, we're training in injectables, we're training in surgery, we're training how to fix wounds, we're training how to,
Wow.
treat the face aesthetically. And I have thousands and thousands of supervised procedures, independent review boards, oral exams, written exams, ongoing CME requirements. And that all kind of culminates in who I am and what a plastic surgeon does. Now, I'm not saying that this is required, but you can see how that might be different from an 8 hour,
8 hours. Yes.
like 8 years versus 8 hours.
8 hours. Right.
Not everyone needs 8 years, but you need more than
Eight
just a weekend.
hours.
Yeah.
Yeah.
So that's kind of the issue with that. So you can see the gap between that and a weekend course is enormous, and patients deserve to understand that that gap exists.
Yeah. Okay. So if I'm calling, looking for an injector, what questions should I be asking?
That's a great question. So look at you.
Thank you.
So the least that you want to start with is a licensed medical provider. So
Okay.
either an MD, a DO, NP, PA, or an RN.
Okay.
So that's like the least. You can look that up. That should be readily available.
Okay.
You want to make sure that if they're not a doctor, that they can clearly identify who their medical director is,
Okay.
who they are, whether or not they're on site, and whether or not they're available. They don't always have to be on site, but they do have to be available by phone, and they have to be available to fix a problem if one comes up.
That's a really good question to ask because if they can't answer that, then that's kind of sketchy.
Exactly.
Yeah.
And if they can't answer that, then they don't know and they don't have a
Right.
protocol.
Yeah.
They're just
He's a
not
ghost
safe.
doctor.
Yes.
Hmm.
And the other thing you should ask is what are their protocols should something go wrong?
Okay.
So if you have a vascular occlusion, do you have that hyaluronidase on site or hyaluronidase?
Okay.
It's not easy.
Okay.
That's 8 years of training. Thank you.
Right.
And I still don't know. But yeah, you want to make sure they have that stuff on site and they're not just saying, passing you a piece of paper saying,
Right.
go to the ED.
Okay.
You
Right.
know?
That's
Yeah. So, they should have hyaluronidase on site and know how to use it. And that's all you just have to ask that question. Do you have hyaluronidase? And if that isn't immediately yes, then you need to get out of that practice.
right. And if you can't pronounce that word, what are the protocols if something goes wrong?
Hyaluronidase. Okay, ready? HYALURONIDASE.
Boom.
We'll spell that out for you.
Okay.
Hyaluronidase. Nope, the other way. Hyaluronidase.
Okay, got it.
Cool. Okay. So I've been kind of shitting on med spas this entire time, but there are good med spas. And I don't want this to come off as like an anti med spa sort of discussion because there are med spas that are run well, safely, and have good injectors in it. And how do you find those? So, as we talked about before, a well run med spa will be physician owned or physician supervised. They'll have trained staff with real protocols. Uh, they're good because they make aesthetic medicine more accessible to the masses, and that's a genuine benefit for everyone out there as well as for me. Like I live in a world that is possible because people understand of aesthetic medicine better, and having med spas out there is always good as long as they know what they can and cannot do. Being more convenient also means it's more affordable. That's all. These are all good things for the consumer. But there are ways to tell if a med spa is not on the up and up. So if it feels like more of a business
Or like a
that
factory.
or a factory
Yeah.
or like, and the business comes first and medicine comes second, that's a red flag. If the medical director is really just a liability shield and doesn't have anything to do with the practice, that's a red flag. If they don't have a clinical leader, if there's a high turnover injectors, if you're every time you're going there, you're seeing a different injector,
Mhm.
and no
That's
one's
another
really
thing. Stick with your injector because they know your face.
right. Yeah,
Uh,
absolutely. And if your injector moves or whatever, make sure that whoever's taking over knows what you've had done
right,
and has the records, or at least you can communicate that to them,
right.
which I get all the time. I mean, obviously, people have issues or they, for whatever reason, don't end up staying with their injector, but knowing what you've had done, which most people don't.
No, I mean, I moved from Florida, and when I wanted to come up here, they're like, "What do you have in your face?" Well, nothing, honestly, guys. Honestly, nothing. But I was like, I have no idea.
Yeah.
No idea.
And that I get that all the time. People just kind of like, I don't know. They just put whatever in.
Yeah.
I really try to enforce my patients or get them to understand what I'm putting in because, and honestly, they probably forget, but at least I make the effort because one, I think it's important for them to understand, and two, super important for them to know just going forward. I have my record, so I can always go back if things don't work out exactly how I want. I know exactly what I did.
Mhm.
Shabeli, if she needs to be here or whatever, she knows exactly what I
Yeah, or
did.
if you, like, need a tweak, like, maybe it was too much in my
Yeah.
forehead.
Yeah. The other thing to think about is if there's a lot of pressure for them to upsell you, to like oversell you on things, these are all red flags. And the difference that matters is not med spa versus plastic surgery practice. The difference is what happens when you have a problem,
Right,
right?
that's true, yeah,
And
that's
who
a good
answers
point.
the phone? Who knows your history? Who will you see the same day if something's wrong?
Right.
So these are the things that,
So, the most common thing that I'm hearing is that when I talk to patients that had bad experiences, they call the practice and no one calls them back, or, like, they can't get a hold of anybody,
yeah,
and, I mean, factory, it's
exactly.
just yeah.
Yeah, and that's a huge problem. And, here at Clareo, there's always a doctor on call.
Mhm.
There's always a way to get a hold of a physician or a PA. And that's another thing to remember. If you have access to someone
Right,
in the event that something comes up, you want to make sure that you're taken care of.
right.
And with us, and hopefully with other good med spas, that will be the case.
Yeah.
Because you don't know when something you're going to realize you have a problem, and it could come up after you've left. So you need to know that you're going to be seen immediately if something's gone wrong, and that should be a minimum.
Okay.
So med spa industry's accountability when things go wrong, I would give it an honestly score of about 4 out of 10. The best ones are genuinely excellent, but the average is not.
So how would you get a 10?
Yeah.
Give a 10.
So 10, every facility would require to have a physician on site
Okay.
or at least immediately available in
Okay.
the event of an emergency.
Okay.
Every injector would have a standardized, independent, credentialed sort of training. Uh, a national complication registry would exist, and we have none of those things. Not because the infrastructure doesn't exist, but because no one's been forced to build it. Because there's
Yeah.
no standardization across all med spas.
Like dentists. I mean, no offense, dentists, but like anyone, the gastros are giving like
Yeah, exactly. Anyone can do it. There certainly should be some accountability when it comes to when things go wrong. And I'm not saying things can't go wrong in any practice, but when things go wrong, they need to be analyzed and figure out how things could have gone better or if everything was done correctly after things went wrong. So let's get to Ask Me Honestly. The first question we have. All right. Question one. I've been going to the same med spa for 2 years and I love my injector, but she just left and they assigned me to someone new. Should I be worried?
so can I answer this one?
Sure.
Okay.
Go for it.
As I just took my 8-hour course, so I can. So I would say definitely pay attention. The relationship that you have with your injector is so important. And it's way more important than people realize. I mean, you do want someone who knows your facial expressions. I mean, I know for myself, when I smile more on my right. So I want my injector to know. I don't know how they would do that, but it's just they need to know your history, how you react to things. And starting over is real.
Yeah.
I had to do it.
Yeah.
So
Absolutely. I mean, I completely agree. I mean, a high turnover tells you that there might be something wrong with the business or how it's run. And a practice that retains staff is usually one with good culture and good
Mhm.
clinical standards,
Yeah.
one that performs well with patients. And if they're performing well, usually not high turnover. But yes, turnover, if it's high, is a red flag. Certainly, obviously, injectors will move. It's not always the med spa's fault, but certainly need to think about that when it comes to your injector. It's not something where you need to leave immediately, but you should sort of vet the new person and
Ask
ask
questions to see if
exactly.
they're paying attention to your chart, and then they know your face and like, "Oh, I've seen what, last couple months."
Absolutely.
Yeah.
And make sure they're asking you the right questions,
Right.
right? If I'm taking over a patient, I want to know exactly what's worked for you, what
Right.
hasn't worked for you, what you liked in the past. So, if anything about the new person doesn't feel right, you need to trust that instinct.
Yeah. Trust your gut.
Yeah. And that's the same
Trust your gut.
anytime we're doing anything aesthetic. You need to trust your gut. All right. Question 2. My esthetician just told me she's now offering Botox. She trained with a doctor friend. Should I let her do it?
So I think we talked about this and we touched on it, but no. Okay. But Chris, go ahead.
Yeah. So an esthetician, regardless of her skill, I don't give a about what she's done to get a certificate. It doesn't matter what she shows you. She is not allowed to inject you. Period. End of story. Full stop. Get out of there as fast as possible.
Yes.
So, there's no malpractice insurance covering you, no licensing board to complain to, and no accountability structures. So it's not worth the effort.
No.
I don't care how good her results look on Instagram.
No. Because also, don't you have to wait? Like if you do Botox, it's not something you can dissolve.
Yeah.
Like you have to wait. You're
Yeah.
stuck like that.
Yeah.
So
Botox, I mean, and like when Botox goes wrong, it's not as like, tissue threatening, but you still might have to live with an eye
or like
that
just
looks like this.
constantly like that.
Most things can be fixed, but I just wouldn't. This is a hard no. Period.
Yeah.
End of story. No cosmetologists, no estheticians.
Keep it simple.
Yeah. No judgment to the patient. It's easy to rationalize, especially when someone's like giving you a, a nice deal.
Okay. Yeah. I'd like to talk on the deals. Go
Yeah,
ahead.
yeah, absolutely. Well, our next question gets to that.
Good.
Okay. Because, I mean, what do you have to say about deals?
Well, like specifically today, we had someone who came in and they were like, had their head down and they were like, "Oh, I'm here to see Dr. Lee. I went to somebody who was cheaper and like she like wiggled and she had some like, I don't know, I don't want to say
Yeah.
deformity.
She had a peaked eyebrow. So she was like,
Yeah. And like it just, she's like, I'm like, so why did you go there? And she was like, well, it was cheaper. I'm like,
yeah, I know. And this is someone who I've injected many times. I've done a great job every time. I'm very
walked
happy.
the walk of shame down to the,
Yeah.
the room.
Tail between her legs. And this is what happens. Listen, I will always take care of you,
We love you.
but I might shame you a little bit.
A little.
Just like a little. Only because you deserve it.
And I'll talk shit.
And we can't have it happen again. And then you get called out on this podcast. So deal with it.
And I won't break HIPAA.
Yeah,
So don't worry.
we won't say who it is. But you know who you are. All right. So along these lines, here's our next question.
Okay.
I got offered a Groupon for filler.
God. Groupons.
$2.99 a syringe. My dermatologist charges $800.
I don't want to hear this anymore.
Is the cheaper place just less greedy?
I'm going to let you guys answer that one. Sounds like you know it already. Don't do
Yeah.
the cheap route. Groupon? I didn't even know you could do Botox. with Groupon.
I'm sure someone's doing
I've
it.
gotten a car wash on Groupon. It was very good.
How it ended up okay?
Ended up okay.
Yeah. No issues?
No issues, but Botox, my friends. No.
Yeah, not worth it. Listen, at wholesale cost, injectables, let's say filler is about $200. And that's at wholesale. That's when you're a provider that's buying a lot of filler. And at $2.99, you have to think about the margins. Like people only think about, cost of product, what I'm paying. But the reality is it's cost of product, cost of, facility.
Right.
So we pay anywhere. So a plastic surgery or med spa around here is going to pay anywhere from $10,000 a month to, $60,000 to upwards of $100,000 a month just
Wow,
for the
yeah.
space,
Okay.
just to move in. And then there's paying for our lovely PCs, our MAs, our PAs, paying for all the equipment that's here, all the medical supplies, paying for malpractice insurance, which, I mean, don't get me wrong, we can talk about how $40,000 per provider is way too much to be paying for medical malpractice, but this is the world we live in.
Yeah.
It's a litigious culture. We have to cover ourselves, and that is the market value for
Wow.
that. And that's every year. And
Wow.
so you have to think to yourself, if someone is only getting $99 on top of what they're paying, what are they cutting?
Yeah.
You know?
Or what are they using? Like,
Yeah,
are they diluting it?
exactly. Exactly.
Because that's insane.
Or is it real in the first place?
Right.
Because that is just that margin just doesn't work fiscally. There's no way that works. So, like,
And they're on Groupon. That's
absolutely.
like,
And they got to pay for that.
right.
Like,
Okay.
they're paying for the marketing. Like, what? They're not living, clearly. Like, those people are not
No.
eating.
No. But they're so skinny.
Yeah, exactly. Thank God. Thank God. So, the first thing that usually gets cut is oversight because no one really, that's the first thing. Second, more alarming a possibility would be, discount filler is not what it claims to be. So, as we talked about before, counterfeit injectables or dermal fillers are a documented growing problem and ordered from overseas marketplaces, unknown contents, unsterilized materials. And the FDA has issued warnings about all this. If the price makes no economic sense, then it's probably for a reason. So ask why.
Yeah. Okay. So then it's not really about greed versus value,
Right.
you're saying. Okay.
Right. Yeah.
Okay.
So and
It's
and
just what's in the syringe
could kill you.
could kill you.
So that thing. So you got to watch out. And if it doesn't make sense, if it seems too good to be true, it
Mhm.
likely is. And as we said, it could be fake. It could be diluted. There's a lot of different things that could be happening, and you got to make sure that you're covered because unless you're watching things come out of a package and directly injected into you, and you're taking very close or paying very close attention, you don't really know. And there is a layer of trust that you have to give to your provider to take care of you. And your dermatologist charging $800 is, paying for real product, real staff,
Yeah.
real oversight, real insurance, real accountability. That's
Right.
not greed. That's
That
just a lot of legitimate medical procedure expenses. And that's what it actually costs to run a practice.
makes sense.
So, all this said, you have to understand that the injectables industry, it can be inherently or comes with some inherent danger. Done right, Botox and filler are among the safest procedures in aesthetic medicine. I think they work for a lot of people, particularly in our age range. People who aren't quite ready for a facelift are starting to lose a little bit of volume. Maybe someone who has lost some weight, has lost some volume from their face. So they are very good procedures, and I completely believe in them and I will continue to use them as a tool for my patients. But done right requires work on your end because the industry won't
Yeah.
do it for you. And there are 4 questions every patient should ask. Who is actually injecting me? And what is their license? Who is the medical director? And are they on site or available? What happens if there's a complication? And do you have
Oh,
hyaluronidase
yes, hyaluronidase.
on site?
Yes,
Those questions are not rude.
at all.
They are a minimum.
And if they make you feel rude for asking it,
Yeah, they are a minimum. And, you are completely in the right to ask them. You're a responsible patient.
mhm,
You are advocating for yourself.
mhm,
And you should know them or the answers before someone puts a needle in your face.
yeah, agreed. So if they can't answer those questions clearly, or did they make you feel bad about answering them or asking them, then that's exactly your answer. Like, just that's it.
Yep.
If they make you feel bad, go with your gut.
Yeah.
If your gut's saying something, listen to it. It's not just hungry. Okay, listen to.
Not today. So that's your answer. And I just want to say, you know, thank you, Jenna, for joining us for
What
this,
do you want to thank me for
for
specifically?
being the beautiful patient coordinator that you are, and a pain in my ass sometimes.
Absolutely, anytime.
And yeah, and that's honestly, if you have any questions or comments, please leave. Our DMs are open. Leave comments in the show page. We're happy to answer any comments that come out. Even better, if you want to leave a video or voice message on our Instagram, honestly pod. That's great. We'll get to them as we can, and hopefully we can get you on the air.
Sweet.
Thanks, guys.